Good morning, everyone. Thank you for joining us at the Public Safety Solutions for Substance Use Disorder ECHO, brought to you by the Center for Substance Use Training and Telementoring, CSTAT, at Bewell, Texas. I'm Kato, and I will be facilitating our discussion today. A few quick housekeeping notes before we begin. These sessions are enabled for live closed captioning. If you would like to view closed captioning for this session, please navigate to the bottom of your Zoom window and select the Show Captions option. You may need to click on the three dots or More menu at the bottom right corner of your Zoom screen to find this option. If you are having trouble accessing captions, please chat Julio, our Echo IT for today. And to help us with attendance, please enter your name, affiliation, and email into the chat. And to access the chat feature, click on the speech bubble icon on navigation bar at the bottom of your window. And also, please note that we are recording these sessions for later distribution through the Bewell Texas YouTube channel. Any information you put in the chat will not be shared on those recordings. And we encourage everyone to join by video for the discussion portion in the latter half of the session. That said, regardless of how you've joined us today, we are just happy that you're here to learn alongside us. And please stay muted unless you're speaking, and we do encourage you to speak. If you've joined by computer, your mute button is on the bottom left of your Zoom controls. And if you're on the phone, press *6 to unmute. You can also use the reactions menu in the bottom right of your Zoom screen to raise your hand and indicate that you have a comment or questions to share. And there are a lot of us in this space, so please keep your comments brief to allow others a chance to share as well. And finally, please note that no protected health information is allowed in either the chat or our discussions. And that includes names, addresses, dates, pictures, or any information that can easily identify a person. And towards the end of the session, the Bewell Texas team will send out a link to an evaluation survey. Please fill it out for a few reasons. One, it gives us your feedback on how to refine and shape these sessions to address your priorities. And also it allows you to access free continuing education. We are approved for CEs for paramedics and any public safety professionals with a behavioral health degree. All participants filling out the survey will be automatically entered into a drawing for a $30 Walmart gift card as well. And today's session will start with a presentation on the Overdose Response Program, Reducing Overdoses, by Dr. Fox and by Dr. Romain-Harrot. And following that, you'll hear a case from Melissa. And there are a lot of professions represented here today, a lot of experiences and perspectives. I encourage each of you to share that during our discussion so that we can learn from each other in this space. And let's move on to some introductions. Cynthia.
Good morning. Happy to be here today. Excited about the session we're having. My name is Cynthia Mendiola. I am a retired federal probation officer, also a trainer and coach in core correctional interventions, and I'm happy to be here. Thank you.
Thank you, Cynthia. Jeremiah.
Hi, everybody. I'm Jeremiah Golka. I'm Executive Director of the SHIELD Training Initiative. We do occupational health, safety, and wellness and effectiveness trainings for first responders and criminal justice professionals working in their roles responding to the overdose crisis. So really looking forward to learning today.
Thank you. Brandon.
Hi, my name is Brandon Del Pozo. I'm an assistant professor of medicine and public health at Brown University. Prior to that, I was the chief of police of Burlington, Vermont for 4 years, and I was in the New York City Police Department for 19 years. Been to Texas a few times now. Really enjoyed my time there. I'm actually wearing a Texas belt buckle I bought at Cavender's, just not as a special thing for today. It's actually my go-to belt up here in the Northeast. So I jumped at the chance to be part of this echo. Thank you. It's great to see everybody here.
Thank you. Dr. Miramontes.
I'm serious. Here it is. See? Not joking.
Hello, I'm Dr. Dave Miramontes. I'm the physician medical director for the San Antonio Fire Department. We do a lot of addiction work. I have 2 paramedic teams out every day doing buprenorphine inductions, harm reduction, and overdose prevention work. So this is my thing. Public safety is me. I eat, sleep, and well, my wife says I don't sleep very much. Public safety. So there you go. Glad to be here. I'm here on my vacation because I think this is so important.
Thank you for joining us today, Dr. Barrow-Montes. Andrea.
Hello, everyone. My name is Andrea Hetler, and I'm one of the program coordinators here at the Center for Substance Use Training and Telementoring, CSTAT, and welcome, everyone.
And Sydney.
All right. Thank you, guys. I'm Sydney Fox. I am a technical advisor for the Overdose Response Strategy program. I specifically provide support for the Midwest region generally, as well as being the technical lead for prevention. And I'll get into my applicable background a little bit as we get into the program, but that's me quickly.
Amazing. Thank you. And Melissa.
Hi there, I'm Melissa Romain-Harrot. I am a public health analyst with the Overdose Response Strategy for the Houston, Texas region. Yeah, and I'm also a woman in long-term recovery. And yeah, that's me.
Thank you. And Sydney and Melissa, whenever you're ready, please go ahead.
Awesome. So just to check, can you guys see my screen?
Yes.
Okay. Like before I just dive right in and get going, making sure. So let's disclosures. We do not have any relevant financial disclosures. And the opinions are our own. These are our learning objectives quickly. And then this is Melissa and I. So we did want to give a little piece here. Wendell was not able to join us today, so we will be covering his portion of it. But we definitely want to highlight the fact that Wendell is part of that 2-person team that is in the Houston area, Melissa being one of them, Wendell's the other. That's such an important caveat for this program, which we'll talk about a ton as we get into the presentation. But I did want to just highlight that. Quickly for this group, this specific audience, my relevant background, I have a PhD in public policy and administration, and my research specifically focused on that intersection between opioid policy and implementation theory at the local level. So that feels fairly well known from folks in this room that that speaks to others. But before I came to the ORS, I did work for the Idaho Supreme Court, where I had experience with problem-solving courts, including drug court, veterans court, and mental health court. So I felt like that was another little piece of my background, but I'll turn it over to Melissa to more thoroughly introduce herself.
Yeah, hi. Yeah, so I have been in this role for about 1.5 years now. And before coming to this role, I was over at the Council on Recovery in Houston with their Prevention Resource Center. I was the regional evaluator for Prevention Resource Center for Region 6 in Texas. And I wrote that RNA, the Regional Needs Assessment, on an annual basis, and reported out on substance use trends in youth, indicators of risk and protective factors are associated with that. Yeah, before that, I worked in educational research, more specifically special education and inclusion research. So yeah, that's and like I said, I'm a woman in long-term recovery. I've been in recovery on December 20th. I'm looking at the date on the corner of my screen here. December 20th, I will have 11 years in recovery.
Awesome. And as we mentioned, Wendell not able to be here, but an incredibly important piece of this 2-person team. He is that drug intelligence officer in the Houston area, and we'll get more into what that means as we go. Right. So federal acknowledgement real quick. This is supported in part by the Centers for Disease Control and Prevention, and that the contents are mine and Melissa's, not necessarily the views of the federal government. So getting into it straight away, what is the overdose response strategy? It does have that QR code. So if you guys are interested, that'll take you to our website, which has a ton of really great information, resources. But basically the ORS itself is that unprecedented and unique collaboration between public health and public safety. It was created to help local communities specifically to reduce overdoses and save lives using timely data, pertinent intelligence, and innovative strategies. So pretty simply, the mission of the ORS is to reduce fatal and non-fatal overdoses. We do that with that intentional coupling of public health and public safety and sharing information and promoting those best practices and evidence-based interventions specifically. So again, as I mentioned, each state has that drug intelligence officer or DIO. You'll probably hear us refer to that slang term that, acronyms are tough in this field. So when we say DIO, we mean drug intelligence officer, and PHA is the public health analyst. So again, that intentional coupling of that public health and public safety together. And as we mentioned, that's Melissa and Wendell for the local Houston team. So the overdose response strategy, these are our sort of key ways that we try to assist our local communities through collaboration across those fields, sharing data and insights, drug trends, things like that, making sure that the latest and greatest is always out there, and then informing and helping local communities. These are the program strategies. So there are 4 overarching strategies. All of the work that the ORS supports fall under one of these categories. And I am going to cover those pretty briefly, but Melissa's going to get a lot more into what that looks like on the ground, both at the end of this presentation, as well as during that case study portion. So sharing data systems, right, to make sure that what is actually happening in that local community? What does that really look like on the ground? Having that data, super important. Number 2 is that immediate and evidence-based response efforts, making sure that what we're doing actually has that evidence base is best practice. We want to promote things that we know work, not necessarily the things that are, exciting or that are always sort of status quo. We want to make sure that that evidence base really is integrated into the work that we're doing. And then that number 3 is really that public safety nexus piece. So maybe things that don't rise necessarily to the level of evidence-based, but are promising strategies at that specific intersection of public health and public safety. We want to make sure we're including building the research base, right? Building that evidence and focused on that intersection piece. And then number 4 is that prevention. That's where the hat that I wear, but supporting evidence-based prevention strategies that are known to reduce substance use and overdose, as well as not using ones we know to be ineffective or conversely more harmful. So how do we do this? So ORS is implemented by those teams, as we mentioned, each of our jurisdictions. We now have all jurisdictions, so all 50 states, including DC, as well as the Virgin Islands and Puerto Rico, all have at least one team. In Texas, we have multiple teams, as well as in Florida and California. So they have their own, specific regions of the state, but the idea is that they're made up of that, a public health analyst and a DIO together working in the field. Again, that promotes that public health and safety at the same time, but also is designed to increase that positive impact and, positive outcomes at those intersections specifically. Again, the sharing the data insights piece, we see this being a really, really key critical part of the ORS. That's that goal 1 with all of its associated strategies. So again, growing that body of evidence, but drug intelligence officers come from law enforcement backgrounds primarily. They have that finger on the pulse. They know what emerging trends exist. They can see what's going on, especially in that local nexus, that local community piece. Whereas public health analysts typically have more experience maybe on the epi side, or, at least with analysis, education backgrounds that tend to promote that piece so that analysis and being able to see what is really going on in our communities and what do we do to respond to it. And again, that coupling piece. And then again, that leads us to that inform and help local communities developing local solutions specifically. So we want to make sure that, folks in the community are as safe and healthy as they can be, and making sure that leads to the best available evidence, that using the best strategies specifically. So the relationship between CDC and the CDC Foundation. So Melissa and I both work for the CDC Foundation. It is an independent nonprofit that was created by Congress to support the CDC's mission and work. And the CDC supports the ORS by making sure that there's a public health analyst in each of those jurisdictions, as well as supporting our national team, which is what I'm a part of, in those key program activities. Whereas ONDCP and the HIDA, so ONDCP, the Office of National Drug Control Policy, is under the White House, and they administer two grant programs. One of those is the HIDA, or the High Intensity Drug Trafficking Area. That is where our DIOs sit, and they support the ORS by providing funding for that DIO position, as well as other key activities on that side. So we have that sort of co-happening response with the CDC Foundation and the HIDA. So then this is really, those teams. Both of these positions support the overdose prevention efforts at the state and local level at that intersection of public health and public safety. PHAs are strategically embedded within the agency, like health departments, usually, sometimes fusion centers, medical examiners' offices, universities, and then they also support their HIDA investigative support centers, where, as I mentioned, that DIO is then assigned to the HIDA or a fusion center sometimes in their state, but they have that, finger on the pulse of what's going on in that public safety realm. Together, right, that gets to a place where knowing what's going on both sides, not only remaining in the silos that exist so fervently, gets to a place of, hey, we can actually see what's going on both sides, and what do we do about that? So with that, I'm going to turn it over to our public health analyst in Houston, Melissa Romain-Harrot.
Awesome, thank you. Okay, so I was going to start out by talking a little bit about some of our collaborations, and I'm not going to read through all of our collaborations here, but I'm just going to point out like the top line here. So I say largest, but our most important like high level organizational partnerships or partners that we do collaborate with, especially on with regards to our monthly collaboration meetings under the ORS for the Houston area. Our HIDA, our Houston HIDA, and of course that includes Wendell. And like Sydney said, most of our DIOs come from a law enforcement background, and so Wendell is a retired DA agent, so he brings a lot to our partnership here in Houston. And accordingly, DEA, we work with Houston DEA quite a bit too. But back to those initial partners, Texas A&M Opioid Task Force is another one of our partners. Our main partners, like under the ORS umbrella, Dr. Joy Alonzo is over at the Texas A&M Opioid Task Force. We use one of her trainings in order to, push out naloxone training and overdose education in the Houston area and surrounding areas. Harris County Public Health is also another one of our partners. And then also Dishes is our other like major partner at that level. And I'm not going to read all of these out to you. But I can tell you that as far as being a public health analyst and being, embedded in the Houston and recovery community, I'm very active in the recovery community. And I before even coming into this role, I hold several, whether it be leadership positions or sit on planning committees and things like that. For our Houston Recovery Initiative, which is our ROSC in Houston, as well as our adolescent ROSC and things like that. So next slide. Okay, so one of our projects, and I've got a list of projects that I'm going to talk about when we come back at the end here. But one of those projects that I chose to kind of emphasize and to elaborate on today is our OENA training. So that would be our overdose education, naloxone administration training. but specifically with law enforcement and school resource officers. And although, I am part of those trainings, those are headed up, in large part by Wendell, my DIO. And so over the past few months, he has been making his rounds all over the Houston area. I think he has presented for and trained more than the SROs, the school resource officers, for more than 50 independent school districts in and around the Houston area. This training is kind of built on and kind of morphed from what we do with the opioid task force training, the OENA training that both Wendell and I are trained in providing, that came out of A&M, which is like a 2-hour training, but it's very it's more pharmacological based and things like that. There's a pre and post test for that particular training. But for the law enforcement aspect that Wendell has been, I guess, catering to, he has worked on taking a presentation that includes a small portion of the OENA, but also largely includes aspects that really do apply to law enforcement in the field, right? And so I was going to kind of go over some of the major points, major aspects of that training that Wendell does with law enforcement. And like I said, it has been mainly with SROs, but it has not been limited to the SROs. It's also been, he's also delivered this training to constables. Sometimes in the more rural areas, constables are the SROs, right? They're the ones who play the role of the SROs on those campuses. And so Wendell has been, definitely hitting all the bases for that. So one of the things that Wendell presents on when he delivers that training are drug trafficking trends, emerging drug threats, things like that. And these are just some, pictures from some of the slides or screenshot from some of those slides that he touches on. So he'll talk a little bit, about what they're finding, what has been found in clandestine labs. And as you can see, there are some pictures right there. He talks about how they use the 2-finger method, which is such a precise method of measuring their chemicals as they mix them. And he has a very, he has a very good way of describing those situations and some of those investigations that have come from DEA. I'm pretty sure these 2 pictures on the side here have come from DEA as well. And then also some of our information that is shared on the DEA website, but he does talk about other drug trends and things like that in addition to that. So as you can see here, we've got some, discussion of what was seized in 2023 by DEA as far as pills, and then also pounds of fentanyl powder. Fentanyl is our main culprit, is our main focus. Here in the Houston area, but we do have other things that we talk about, such as xylazine. We are seeing that in the Houston area and other emerging threats. I think one of the others, medetomidine, is another one. And then we've heard recently from some folks on interesting things on kratom. And then also some of our data that we pull from, this is from the Harris County Institute for Forensic Science. They're the deaths that are associated with, or overdose deaths are associated with fentanyl here for, and I think we have all, and then I think we've got youth showing here throughout the years, and those are numbers that move on through 2023 there. Next slide. Okay, so one of the other things that Wendell talks about when he visits with a lot of the SROs around the Houston area are some of our recent legislation. And some folks, we've been in rooms like with EMS and first responders who have not actually aren't quite aware of some of the legislation. And so this is some of the legislation that I think all 4 of these went into effect in September of 2023. And as you know, if many of you are first responders, you might be aware, but maybe not. The legislation went into effect, but that doesn't necessarily mean that there is a deadline for compliance or that there is a deadline for compliance. So everyone that we've come in contact isn't at differing levels of implementation of the legislation. So, Tucker's Law, which is, requiring public schools to provide 10 hours of fentanyl education in K through 6th grade. The next one was providing naloxone access on schools, and so that's why he's really been hitting the SROs and working with the SROs. But also, at the bottom there, you see reporting overdose information. We're not getting a lot of information of what's going on as far as overdoses on campuses. And so this has given us a chance to, be able to talk to some of those folks about what they're seeing on their campuses as well. And then also House Bill 6. Okay. I'll move on. House Bill 6, criminal offense for fentanyl deaths that result in death. And I already hit on that last one, so I'll move on to the next slide. OD map. So some of you may or may not have heard of OD map. That's another one of the points that Wendell touches on. It's a reporting system. As you can see, you can tell where we are. It is implemented around the United States. Texas, we're still building on that implementation. We're asking folks who sign up for, implementing OD map to report fatal and non-fatal overdoses. It's real-time information there. Let's see, free of charge. Free of charge has been a big one too. Okay, and so what we've been basically, operating on an agency by agency recruitment in Texas, and we're still building on that. And hopefully there might be some implementation at the state level in order to put in an alternative interface platform so that EMS data is automatically fed into that. We have that in place in other states in the US, and we're very hopeful to be able to move into that in Texas. Next slide. Okay, and then these are some of the overdose, I guess, education that Wendell includes. It's not the full, slide deck that we do as part of the A&M's opioid task force training. But Wendell still includes like a couple of slides on what overdose looks like, as you can see here. And next slide. And the mechanisms of how naloxone works in reversing an opioid overdose. Next slide. And then also responding to an opioid overdose and that naloxone administration. Next slide. There you go. Got you in 5 minutes.
We did our best not to go over. So
Right.
are there any questions before we move
Yeah.
into the next section?
Thank you, Sydney and Melissa. Yes, Sydney said, are there any questions or comments in the Learning Network? Yep, please feel free to drop it in the chat if you have any questions. And Melissa will be giving us more details on the projects in the latter half of this session as well. So.
I have a question in regards to training. You say you do a lot of training. Is it training for anyone, like any agencies? Do the agencies contact you to make requests for trainings? How does that go about?
Yeah, I think some of it has been a little bit word of mouth. When anytime Dr. Alonso always, considers Wendell and me as kind of like a package deal kind of situation with A&M. So anytime like she gets a request, she'll send it out to us. If she's not able to do it, Wendell or I will pick up that training. So we've done it. I trained the HISD, Houston Independent School District nurses, which was about 250 nurses. It really, whoever reached it, he's even adapted it a little bit to do assemblies at schools. So we have a school district up north where he did, 3 days straight of assemblies with all of the classes at that particular high school. So it just, whoever needs us, I've done it out in Bastrop for their CERT team. Yeah, just really.
So this information would probably benefit, organizations like federal probation officers, or parole officers, or individuals that are coming into contact with individuals that have substance use disorders.
Yes, especially the curriculum kind of that Wendell has put together and has been really pushing out to the SROs as well. Because what I gave you here was just it did not even come close to doing justice the kind of information that Wendell makes available for those specifically in law enforcement. Yeah.
And another thing I'd like to highlight too is, we have teams across the country that are doing all kinds of different things. So as long as it associates with one of the goals. So Melissa had talked about ODMAP a little bit, but also overdose fatality reviews are something that a lot of our teams are engaged with. Also the public health and public safety teams toolkit. So the FAST, if you guys have heard of the FAST toolkit, we help support that. And then when it goes into other goals, so targeted naloxone distribution, for example, lots of experienced teams are engaging in that space, especially targeted communities where there is a need. And even things like MAT, right? Or MOUD, and that within the criminal justice system. So anytime there's that nexus between those two, if it fits within a goal, we can absolutely be involved in that space. So it's kind of limitless. If there are populations that touch the criminal justice system generally or the public safety side, we'll probably have a hand in it within at least one of our teams.
Yeah.
Thank you. Before we move on to case presentation by Melissa, we have a few announcements. Julio, could you please share the slides? Right. Thank you. Okay, and do you have a difficult case that you or your team have encountered? CSTAT offers you the opportunity to present any challenge your organization is encountering and receive feedback from our hub of experts and broader learning community. There is no need to prepare a formal presentation. We will provide a case form to fill out to assist with your case presentation. If you're interested, please email us at cstat@utesca.edu. Next slide. And to claim your CEU credit, you must complete the post-session survey in the chat or by the email sent after this session. Complete the post-session survey and select yes on the question, are you applying for CEU credit for today's ECHO session? Your certificate of completion will be sent to you 2 to 3 weeks after the session date. Next slide. And we're excited to announce that the 2025 Texas Substance Use Symposium is officially open for registration. Register today at txsus.org to join us in person or virtually on February 27th to 28th at the Hotel Paso del Norte in El Paso, Texas. Next slide. And we are now accepting sponsors and exhibitor applications for the 2025 Texas Substance Use Symposium. 100% of your support will go towards providing a free continuing education for all attendees, funding travel grants for experts in the field, and underwriting other event-related costs. To learn more, visit the link you see here, txsus.org/sponsor TXSUS. Next slide. And next month, we will meet on January 9th for the first public safety ECHO of the year. And we hope to see you there as well. I think that's it. All right. Melissa, whenever you're ready, please take it away and tell us more about the projects.
Oh, okay. All right. I didn't know. Are we going to have that slide up or did y'all? Oh, okay. There we go. Thanks, Sydney. Okay. So I thought we would take this opportunity to talk a little bit more and elaborate on some of the projects, the other projects that Wendell and I are involved in the Houston area through the ORS. The bolded one is what I just kind of elaborated on. I chose that one to kind of talk about with you guys because this is a LE focused group. Yeah, but I think it's really important to kind of talk about some of the other ones because they really kind of touch on some of the things that Sydney was just talking about as well. In the first one there, that is a collaboration between us. We call it our Community Impact Pilot Project. And it was actually led by DEA out of Washington, D.C. And they reached out to us because they were looking to replicate the Community Impact Pilot Project that they had done in Philadelphia. And they were looking to replicate it in the Houston area. And we, we've got a few communities where we had issues at the campus level, we knew. We knew the community. And so Galveston community and the Texas City ISD were two of those big players there. Dr. Alonso's group with their A&M opioid task force was, and I say was, but is still part of it. We're still ongoing there. And then also Bay Area Council on Drugs and Alcohol. So this collaboration, started off as pulling together community leaders in that area. We had the woman who was leading this, Dr. Adenaya from DC, from DEA in DC, come and work with us on doing a planning meeting really with the community leaders. And so some of those community leaders were the mayor, I want to say Texas City, mayor of Texas City, like the police chief. We had the superintendent of Texas City ISD there. We had the folks from Bakota. And Bakota is one of our big recovery treatment, organizations in the Galveston area, but in our Public Health Region 6, because that's what we are really focused, Public Health Region 6 as well. The counties don't map exactly onto Houston, HIDA, but our major ones in the Houston, Galveston kind of area absolutely do. So yeah, so we started out planning, trying to figure out what the community needed, what they wanted and needed. We didn't want to be going in, just let's do this for you and that's it. So some of the things that they wanted was education. They wanted, we talked about curriculum, education on fentanyl and on overdose, naloxone availability, and distribution, all of those things that, we know are important, but really wanted to work with the community and looking at community, I guess, readiness and what they want, what their wants and needs were. So a couple of those things were um, uh, I want to say town hall, but we don't call it town hall. We called it a community care meeting. And so we worked with the superintendent over at Texas City ISD and the school district in setting up 2 of those in the fall of this year. But we started planning for it last year, in the fall of last year. Okay. And so we pulled those together and brought in our special agent in charge in Houston. He came out to present, Danny Coma, he came out and presented there with us, and also our local police, local law enforcement officers, EMS. We didn't want to be outsiders coming in. We wanted them to have a role in presenting for these events. So that was one big part of what we did. Another big part is we presented on this the community impact pilot project over at APHA this year in October. And it, like I said, the project is still ongoing in that if you kind of look down the list of bullets here, Teen Think Smart, that's a fentanyl education curriculum, evidence-based uh, program that comes out of A&M as well with Dr. Alonso's group. And so it is a skills-based curriculum focusing on refusal skills with students, and also discussion a bit about harm reduction. Dr. Alonso's group has worked on, rolling that out or starting to roll that out to some school districts in Texas, not only specific to the Houston area, but Texas City will likely be another one of those school districts as well. And so the superintendent was supposed to be bringing that information and the curriculum. It's already manualized, it's developed. I'm actually a facilitator for the curriculum. I've worked with them in their training of it for some of the teachers for school districts and other school districts other than Texas City as well. But yeah, so that was supposed to be going in front of the SHAC. So the SHAC is the School Health Advisory Council or Committee Council, I think. Each of our independent school districts has one, right? And so yes, we are just waiting for the go on that. And I think the hope is to begin with the implementation for that in the spring semester. So that's our first one there. Over the past couple of years, we've also worked very closely up in Cleveland, Texas, and Cleveland ISD. Last fall, they had probably a rash of about 17 overdose events on campuses, on school campuses there, and none of them were non-fatal, but part of the collaboration we do with Dr. Alonso is that she also works with campuses and school districts on setting up their procedures and protocols for having naloxone on campuses. And so she had already actually worked with Cleveland ISD before that legislation for having naloxone on campuses went into effect in September of 2023. And then September and October is when they ended up having those overdose events on their campuses. So they were actually ahead of the game when that happened. But that community has some very they've got some risk factors, some very large risk factors there. And so, we worked, in putting on a couple of town halls with their school district in the community last year. And that was led more by the superintendent last year. And Wendell has continued on this year in working with we have a group, called Montgomery County Overdose Prevention Endeavor. It's MCOPE, that's our angel moms in our area, who do presentations and things like that. And so he's worked with them in doing, furthering those projects and providing his presentation, not only to parents, like we did a Sunday, a community program where he presented to the parents there in that community, and his kids go to Cleveland ISD. So as you were asking before, that was another group that we presented for. And then also that was also the high school that he went on for that entire, the rest of that week presenting for the kids. Yeah, so Cleveland was a big one. Like I said, naloxone distribution and training. It's not so much distribution anymore, because what we do is we educate folks on where they can go for free naloxone now, which is Naloxone Texas. And and I know y'all know that. So we're a big fan here. We where we can, we will place orders, and if we're like in a new ISD, we'll bring like a box of naloxone or a few boxes of naloxone just to kind of get them started. But we always try to get them to order for their own organization, or if it's a school district, for their own campuses there. Yeah, and then I talked a bit about Teen Think Smart. Yeah, and then moving toward better data sharing opportunities and relationships with partners. That has a lot to do with Dishes. So Dishes came on board as part of our larger, ORS specific group this past year. And working with them where we can't get certain information or data necessarily for the whole state of Texas from ODMAP right now. That they are working in setting up better data sharing, special dashboards in order to help us inform ourselves, so that we're able to provide what we can and assist and support those community organizations that we work with. And then the last one, ODMAP, we advocate for ODMAP. Like I said, it's a right now agency by agency recruitment. And every chance we get and every presentation that we do, we talk a little bit about ODMAP on that as well. Our hope is for statewide implementation of it, or at least, developing or setting up an API with that. Yes.
Thank you, Melissa.
Oh, Sydney had just put some, yes, thank you. There we go. She put the goals in the chat for us. Any questions?
Any questions, any comments for Melissa, or Sydney?
I've got a question.
It's Jim.
So my question is, I work with we work with some RS folks elsewhere and get the sense that you all want to kind of informally just have a lot of connections to just like a huge network, basically. So I'm kind of wondering if a lot of the people on this call, a lot of them work in community-based organizations. Some are in first responders. Got some probation. Like, what are some of the kind of introductions, or how can your network be helpful to folks on the call? I can't obviously speak for what the specific kind of connections folks on this call would actually want, but if you wanted to like kind of offer some of that up in case it's useful.
Right. Well, that was kind of one of the, y'all had asked for us to have a question or a few questions for you guys. And that was one of my questions. How can we best serve, right? For anyone who might be on this presentation as well. But yeah, usually I just it's really informal, to be honest. It's really kind of been more of a very organic, at least for me, it's been very organic in making those connections for folks. You can find your local ORS team here. So you guys have an ORS team in South Texas for San Antonio area. You don't have a PHA right now, but you definitely have a DIO, Fred Delgado, and he's awesome over there. And we've got one in Dallas. The ORS team is working with their community networks in Dallas area, North Texas, Dallas, in starting up their overdose fatality review team up there. I'm hopeful that we'll be able to get one started in Houston. But I think that's one of those things for everybody to be thinking about too in your area. And whether at OFR is needed. But it's really, for us, it's really been organic. I mean, you reach out to me and I can point you in the right direction, for sure. We definitely have our ORS teams. Like I said, there's 4. You have one more out in El Paso as well, in the West Texas region.
Yeah, I
And
was gonna just echo that
they
too.
each have their, connections there as well, where they branch out.
Our contact information is at the end of the presentation, but I'm dropping mine in the chat also. If there are specific initiatives or even just things you need to problem solve, you can always reach out to either of us. We can connect you with either the right people or the right resources. Because like Jeremiah mentioned, we have that national network. We absolutely love to promote that. He's been quiet, secretly joined us, but Jim Cormier is our national public safety rep. He's on this call and he is connected with all of the DIOs across the country as well. So anything related to that public health, public safety nexus, we have a whole team of folks ready to jump in. Let us know if we can help you. If you don't know where to start, just let's have a conversation.
As Dr. Miramont, I have a quick question. So who has visibility on the OD map data? So let me tell you why we're a little concerned about that, right? We don't like to have a certain council member have their district light up red, right? Because that creates bad feelings in that council member's district, for example. So who has access? Is this considered law enforcement sensitive information or is it publicly available?
It is not publicly available. And it is event specific. It is not individual specific information. It's not publicly available. Each of the folks who are or agencies or organizations that are registered in it, they can't see anybody else's data except for theirs. And anytime that I've had a request for, can we see all of the data in Montgomery County, for example, right? The only way I can do that is if you are able to get permission for each of the agencies in that area who are inputting data in ODMAP. And so that's something that we can work to coordinate with folks. But the only way is if they have permission from the enterer of that data to see it.
And even if they do, as Melissa mentioned, not only is it not public, but it doesn't have decedent information.
Yeah.
There's no PII or PHI contained in it, and it's also not a system of record. So whoever actually holds, whether it's like she had mentioned, an API coming from EMS, it all only takes those specific data points, which are the general location, because there is also this algorithm that says it may not be exactly right here because there's not enough of the population, right? So in Baltimore, you're going to be able to get a little more pinpoint. In a rural area, it's going to be more general, that type of thing. The data point, basically, whether and the time that the person overdosed, whether or not it was fatal or non-fatal, and whether or not naloxone was used. And then there are some additional case information that can be added, but they're not required for that data point to be plotted. Again, only the people who have an agency agreement with Washington, Baltimore, HIDA can see that, and that is limited to that need to know specifically.
And we would never
Anything helps.
share line by line item data either. That is not, yeah.
So,
if-
okay, so I'm sorry.
Oh,
Dr.
yeah.
Charlotte.
What
I
about-
wanted to add on to that question. I wanted to add on to Dr. Miramontes' question. Then what kind of information in your presentation, you mentioned there was data sharing. So what is involved in the data sharing?
Well, the data sharing, we're working towards that, right? So right now the only like overdose data that we tend to be able to have access to is data that is available, like through CDC Wonder, right? Things like that. CDC Wonder or dishes. I think it's their opioid dashboard, things like that. But there's a lot of data, like syndromic data and other types of data that might be able to still give us a better picture rather than waiting for, like a year out to get death data. That would be helpful for us in preparedness and in I think in working with our communities and just preparedness and being able to identify spikes in overdose events.
And Cynthia, I would mention too that the specific data sharing that exists really depends on the jurisdiction. So what Melissa's talking about is what they specifically have with their unique jurisdiction, their unique circumstances. Some of our jurisdictions have really robust data sharing. I think a lot of that really depends on the trust that's been built, as well as what local and state guidelines already govern that data. But as she mentioned, it could be anything from more basic syndromic type data to, case specific. If we're doing, overdose response, like post-overdose response, there may be specific case information that's shared. It just really depends on what that specific project is and what those relationships are that exist within that public health, public safety component.
Right. Yeah, and like I said, dishes just came on over the past year with us. And so we're very excited about that because I think it gives us an opportunity to be able to engage in better data sharing opportunities and relationships. Texas also is newer than the rest of the United States in ODMAP implementation. And so in the whole ORS realm of things. And so we are still kind of building and learning a lot from our other states. And then, hopefully trying to replicate or, develop our own special way of doing that here in Texas. And what we're learning is that it can be very specific to even our very regional area. of Texas. Right.
Thank you.
Yeah.
Thank you. In the interest of time, Brandon, could you please give us a summary of today's discussion?
Yeah, sure. So I'd like to thank everybody for tuning in. There's a few important takeaways. One that's striking is HIDA's emphasis on a public health and public safety approach, which combines the work of a drug intelligence officer with a public health analyst. That was something that the HIDA system started, I believe, around 2015, but it's now finishing its first decade, which is like provides a vital link between law enforcement strategies and public health. It also provides the opportunity for collaboration and making sure that there's an alignment between those two goals. What we also learned here is, I think, two important things. One, you can reach a wide audience when it comes to distributing naloxone. It's possible to deliver like good, high quality naloxone training. I like that we talked about delivering it not only to SROs, for example, in schools who can be role models and also there at the scene of an emergency, but also to the teens themselves, right? And the other thing that prevailed and that came to light, or just that struck me, is the this link between hard practical skills like naloxone distribution, like knowing about overdose, plus it's like a trifecta. You have the hard skills, then you have things like the science, like how overdoses happen and how opioid reversals work, right? Which is looking at the molecular and biological level. And then you also have the use of administrative data like OD map to detect hotspots, know where to deploy resources. And it shows, that a good strategy combines, again, like a continuum of people, public health and public safety, a continuum of demographics, police and teenagers, and also the entire range of skills and data from what to do, administer naloxone, why and how it works so you can trust it and get behind the idea, and then where to deploy those resources, which is what ODMAP offers. So it was a nice insight into all of that. Thank you for sharing it.
Thank you for that. And thank you all for joining today's ECHO session. As a quick reminder, to earn continuing education credits, please complete the post-session survey that Julio shared in the chat. And we'll see you in a month on January 9th for our next public safety ECHO. Thank you and have a great holidays.
Thank you.
Thanks, guys.
Bye, everybody. Happy holidays.